How are you? Good morning. So today we are starting a new chapter, Neoplasia. So in today's class, we will discuss about what is neoplasia. In the common language, neoplasia means cancer. So we will discuss the various aspects of the neoplasia. What is neoplasia? Neoplasia is a mass of tissue which is formed as a result of abnormal, excessive, uncoordinated, autonomous, and purposeless proliferation of the cells. Even after removal of the growth stimulus, which has caused this proliferation. So this neoplastic growth differs from the normal cell cycle or normal growth in the sense that it is abnormal, number one. Number two, it is excessive. Number three, it is uncoordinated, autonomous, without any purpose. And this proliferation of the cells is continued even after removal of the growth stimulus. Normally what happens? Whenever there is a proliferation of cells, it is not excessive. It is up when whatever is required, up to that only there is a proliferation. Otherwise, this is stopped. But in this neoplasia, this is excessive, uncoordinated, and this neoplasia or abnormal growth may be benign, or in the common word it is known as innocent, when they are slow growing and localized. Another type is a malignant, when they proliferate rapidly, spread throughout the body, and may eventually cause sometime the death of the person. So how you can define this neoplasia? Means new growth. And as I told you earlier, neoplasia means in common word a tumor or a cancer. And this cancer is nothing but an uncontrolled proliferation of cells that express varying degree of fidelity to their precursors. So it can be, this growth may be a benign or malignant. In the benign growth, cells grow as a compact mass and they remain at the site of their origin only. While in the malignant growth, there is an uncontrolled cell proliferation which spread into the surrounding tissue and spread to the distant site also. So in comparison to benign, in which this remain at the, which is number one, it is compact. Number two, it remain at the site of origin. While in malignant, it is a uncontrolled and spread to the surrounding tissue. So how you can give name to this neoplasm? This may be either, as you told you, benign and malignant to broad group, and malignant also. They can be further named if they are arising from the epithelial tissue, then it is known as a carcinoma. And if this abnormal growth is of the cells of the mesenchymal origin, this is known as a sarcoma. I hope you know what are the epithelial tissue, what are the cells or tissues of mesenchymal origin. So it is necessary to recapitulate at this moment. For example, you know the various types of epithelium: squamous, columnar, glandular, and tissues of mesenchymal origin are blood vessels, fat, bone, etc. So if growth is from the epithelial origin, it is known as a carcinoma. If this growth is of cells of mesenchymal origin, this is known as a carcinoma. What happens in this? There is a cellular adaptations in a normal cell. In a varied situations, these cells can respond in a way. Either there can be a atrophy of the cell, so cell becomes small, or there can be a hypertrophy of the cells, cell size become big, but number remains the same. Third, in the various situations of stress or need, there could be a hyperplasia. So hyperplasia means there is an increase in the number of the cells. What is the difference between hypertrophy and hyperplasia? In hypertrophy, cell size is increased, while in case of hyperplasia, the cell number is increased. Or this cell, in this adverse situation, there could be a dysplastic change in the cells. Dysplastic means there may be some change in the nucleus, some changes in the cells, which are according to the stress situations. And this dysplasia may be further converted into a neoplasia, or sometimes there are the cells of the metaplastic change. What is metaplasia? A normal cell in abnormal situations, just to withstand in these abnormal situations, cell makes some changes in its morphology, in its constituent, so it can withstand the abnormal situation or situations of the stress. This is known as a metaplasia. And commonest example of this metaplasia is that the normal lining of the cervix is squamous-columnar junction, that is columnar cells, and these columnar cells in abnormal situations of the stress, there is a metaplasia. These columnar cells that they change into the squamous cells, because squamous cells, they, in comparison to the columnar cells, withstand the abnormal situations in a better way. So there is a known as a metaplasia. So metaplasia is a change in the cell morphology, just to withstand in the abnormal situations. So cellular adaptations, as I told you, atrophy, there is a reduction of number and size of parenchymal cells of an organ or its parts, which once it was normal is known as a atrophy. And the commonest example of atrophy is ischemic atrophy or neuropathic atrophy. In cases of ischemia, means lack of blood supply, there is a atrophy of the cell, or in cases of degeneration or in changes in the nervous tissue, there is a neuropathic atrophy of the cell. What is hypertrophy? Hypertrophy, as I told you earlier, there is an increase in the size of parenchymal cells, resulting in the enlargement of the organ. So The commonest example of hypertrophy is enlargement in the size of uterus in pregnancy. That is a physiological hypertrophy, or hypertrophy of cardiac muscle. It is a pathological. So in cases of increased cardiac overload, there is a hypertrophy of the cardiac muscle. So just to manage or withstand in the stress of cardiac overload, this is known as a hypertrophy of cardiac muscle. This is a pathological. So in neoplastic proliferation, in the benign, as I told you earlier, that number one, it is localized to that area, and number two, it is non-invasive. There is no infiltration into the surrounding tissue. While malignant neoplastic proliferation, which is commonly known as a cancer, which is named after name of a just like crab-like growth. What happens in the malignant cells? Two important characteristics in comparison to the benign, that it is spreading, it is not localized, and number two, there is an invasion into the surrounding and distant tissue. So now we can summarize difference between a normal cell and a cancer cell. What happens in normal cells? There is a division, but in cancer cells there is a large number of dividing cells, or this is abnormal increase in the size number of the cells. Number two, in cancer cells, cancer cells, the cell size become large and there is a variation in the shape of the nuclei. And the most important thing is that there is a large nucleus change in the nuclear cytoplasmic ratio. Normally what happens in the normal cell, the ratio between cell and the nuclear size is 1:3. So cytoplasm is three times than the size of the nucleus. But in case of malignant cells, there is a reversal of this nuclear cytoplasmic ratio. It means the size of the nuclei, this becomes large and it is occupying the large area of the cell. And fourth most common feature which you find in a cancer cell is that there is a variation in size of the cell and shape of the cells, and the normal functions of the loss of normal features of cells, they are lost. And one more thing, normally cells, they are organized in a particular pattern, but in this, that particular pattern is lost, and this is a disorganized arrangement of the cells. And cell boundaries, they are poorly defined in case of the malignant cells. So this is how a malignant cells differs from the normal cell. So you can now sum up with difference between benign and malignant mass is that in the benign, nuclear variation and size and shape is minimal, while in case of malignant, there is a marked variation in the nuclear size, shape. Nuclei, in case of benign, it is usually diploid, while in case of malignant, it is multiploid. Mitotic count in is a normal cell, is a benign cell, it is a low mitotic count or normal mitosis is there, while in case of malignant, there is a low to high mitotic count and this mitosis is also abnormal. Specialized functions of the cells, they are retained in the benign neoplasm, while The specialization is lost in case of malignant cells. Structural differentiation is retained in the benign, while structural differentiation shows wide rate of changes in the malignant cells. Benign, the cell mass is well organized, while in case of malignant, it is not organized, and functional differentiation is found in case of benign cell, while functional differentiation is usually lost. This is how you can see in these two pictures that this is a healthy, this is mass, no adaptations, and there is a dysplastic change. Or this is a, for example, a squamous epithelium. So dysplastic change in the epithelial layers, and according to the involvement of the epithelial layer, this could be a mild, moderate, or severe, or be a carcinoma in situ. And then when this gets started infiltrated, it becomes a full-blown malignant growth or a cancer. So benign tumors nomenclature, usually we use suffix oma with the name of the organ as the root. For example, benign tumor of smooth muscle is known as a leiomyoma. Benign tumor of fibrous tissue is known as a fibroma. Benign tumor of adipose tissue is known as a lipoma. But in some cases, this is confusing. Some types of malignant cells, they also use the suffix oma. For example, melanoma and seminoma, these are using suffix oma, but they are the malignant growth of melanin tissue and testicular tissue respectively. Benign tumor, same. Benign tumor of the thyroid is known as a adenoma. So benign tumor is usually a normal looking, well differentiated thyroid tissue and colloid filled thyroid follicles. One important finding which you see in most of the benign tumors is that they are encapsulated or well capsulated, and they are well defined. As I told you, in case of cancers, they are classified with the type of cells from that the tumor resembles. So therefore, you can say that this is arising from this tissue. For example, carcinoma. This carcinoma, they are derived from epithelial cells, breast, prostate, lung, pancreas, and colon. Malignant neoplasm of epithelial origin, they can be derived from any of the three germ layers called carcinoma. For example, arising from epidermis. I hope you know that there are three types of tissues structure from when the growth can take an ectodermal origin or mesodermal origin cells or endodermal origin. So growth arising from epidermis are of ectodermal origin. Growth arising from mesodermal origin, for example, the cells of the renal tubules, or growth arising from endodermal origin from glandular carcinoma deriving from the layer lining of the gastrointestinal tract are of endodermal origin. So all tissues, either they can be of ectodermal origin, they are epithelial, or they could be of mesodermal origin, as I told you, fibrous tissue, bone tissue, blood vessels, adipose tissue, they all are of mesodermal origin, and either of the endodermal or gland. So if malignant tumor arising from epithelial tissue, if they are arising from the cellular tissue, then they are known as a adenocarcinoma. But if they are arising from the squamous cell, they are known as a squamous cell carcinoma. Sarcomas, malignant tumor arising from connective tissue, they are known as a sarcomas. So I told you earlier that there are growth or are two types. Number one is benign, number two is either malignant. Malignant growth, again depending on the site of origin, they could be either carcinoma or they could be sarcoma. Sarcoma, carcinoma arising from the epithelial tissue, and sarcoma arising from the connective tissue or mesodermal invasion. And the example tissue arising from mesodermal origin are bone, cartilage, fat, nerve. So they all are originating in a mesenchymal cell outside the bone marrow. So this is a adenocarcinoma picture, malignant gland surrounded by fibrous stroma. Lymphoma and leukemia, these are the two groups of malignant lesions. They arise from two classes of cancers. They arise from hematopoietic blood forming cells. And these cells which arise from the bone marrow, they leave the bone marrow and tend to mature in lymph nodes or in the blood. If they are arising in the lymph node, they are known as a lymphoma. If they are arising or taking growth in the blood, they are known as a leukemias. Germ cell tumors, cancer deriving from pluripotent cells. Pluripotent means these cells, they can develop into any type of structures. Most often they are present in testicles or the ovary, and the tumors commonly arising from pluripotent cells in testes seminoma and dysgerminoma in the case of ovary. There are some specialized tumors, for example, adenosquamous carcinoma, adenoacanthoma. Adenosquamous means there is a combination of both gland and the squamous lining. Coalizant tumor, there is two different cancers in the same organ which do not mix with each other. Mixed tumor, commonly seen in the salivary gland, or they are also known as a Cleomorphic Adenoma, is a term which is used to the benign tumors having both epithelial and mesenchymal elements. Then there is a term known as a teratoma. These are the tumors which made up of mixture of tissue types arising from the totipotent cells derived from all the germ layers, means arising from the ectoderm, mesoderm, endoderm. So in the teratoma, you will find that there is a mixture of neoplastic cells which derive from all the three germ layers: ectodermal, mesodermal, endodermal. So these teratomas, these are most commonly seen in the ovaries and testes. And what will you find in the? That you will find the tissues deriving from all these three layers. So means you will see the epithelium, you will see the gland, you will see the blood vessels, you will see the nerve, you can see the glands, you can see the bone, you can see the cartilage or teeth. So all three cells that derive from all three layers, They are found in case of teratoma, and commonly these teratomas, they are found in the ovary and the testes. But these teratoma, sometimes they arise from extragonadal sites also, mainly in the midline of the body, that is in the head and neck region, mediastinum, retroperitoneum, and sacropoccygeal region. What is blastoma? Blastoma or embryomas are a group of malignant tumors which arise from embryonal or partially differentiated cells which would form blastoma of the organ and tissue in the process of embryogenesis. There are some tumors which occur more frequently in the infant and children, these blastomas under 5 years of age. These are neuroblastoma, hepatoblastoma, retinoblastoma, medulloblastoma, and primary blastoma. So these are the special types of tumors. I think this is enough for today. We'll continue in the next lecture. कितने मिनट हो गया?